Well, South Africa is caught in the second COVID-19 wave, and the healthcare system is taking strain. More than 24,000 people have died since the first case was announced. Our reporters are checking out the situation around the country. Nkize is in Johannesburg, Sipamantla Goge is out in Polokwane, Mawanda Keswa is in Durban, and Nobusuthu Jana is in the Western Cape. The province leading the pack in the number of daily infections. We'll be talking to them all throughout the show, starting with Sipamantla and Mawanda. Sipamantla, what is the situation there?
Well, Limpopo as a province is not one of the hardest hit when it comes to COVID-19. This is one of the provinces with the lowest number of infections and cases. If I'm not mistaken, the latest statistics from yesterday, they point to the fact that in this province there are more than 20,000, or there are about 20,220 cases with 526 deaths so far. That's relatively low compared to the Western Cape, Eastern Cape, Gauteng and KwaZulu-Natal. So Limpopo, together with the Northern Cape and Mpumalanga, are one of the least affected provinces. But that doesn't mean to say there are no concerns in this province, because as we have entered the festive season, Limpopo is one of the provinces that attracts so many tourists. Many people make their way to this province, others transiting to other neighboring countries. So authorities in this province are concerned about people who are residents from this province but working in other provinces as well. Gauteng in particular, we know that it's one of the hotspots. So authorities in Limpopo are concerned about people who will be coming back from Gauteng coming to Limpopo, and they are putting all measures in place to deal with that possible scenario, even though for now they have not been classified as one of the hotspots, but they have been placed on high alert when it comes to the second wave. But earlier on, we were able to speak to the nursing union Dinosa in the province. We spoke to Lesiba Munyagi, who's the provincial chairperson. He says their members are ready to deal with the second wave, but they've got some concerns because they say their members are overstretched in this province and they are understaffed. Let's listen to him.
All right, unfortunately, we don't have that clip for the moment, Sipamantla. We'll get on to that a little bit later. I wonder, what is the situation where you are, and what sort of impact is this having on frontline workers?
Well, in case then the picture is quite different. We're looking at a situation where there have been over 154,000 COVID-19 infections. Now, the Premier of KZN, Zigalala, yesterday spoke about the situation in the province. He mentioned a church event that was attended by at least 2,000 people. Just from that event, there are at least 48 COVID infections that have been reported as a result of that event being attended by that many people. Now, how does this impact what we're currently facing? We're in a situation where we've seen an average of about 2,000 new infections daily. Now, this has seen a spike in the number of people needing to be admitted into various hospitals. One of the sectors that seems to be grappling with this challenge is the private health care sector, which is looking at about over 1,500 patients that are currently admitted. We've received reports stating that patients have had to be diverted as a result of the lack of availability of beds. It is a result of this the health department has come to save the day. And how is it doing so? The department says that it has over 3,000 beds that are currently available. You will recall, in the early stages of the pandemic, the department had set out to set up temporary hospitals as well, also utilizing private facilities. Now, those have not yet been activated. And if the need arises, the MEC for Health in the province, Nomakuku Smelane Zulu, says that if the need arises, those will be reactivated to ensure that they assist. So while the private sector is experiencing these challenges, the health department has put in place a contingency plan to deal with the situation that is currently being faced.
All right, let's pop over to you, Mangopa. And what is it that you have been finding out about the second wave and preparations for it?
Well, Jane, we spoke to some healthcare workers, of course, who say they fear the worst should the second wave of the coronavirus pandemic hit Gauteng, we spoke to the General Secretary of the Young Nurses in Indaba Trade Union, Richard Cleaner, just a short while ago, Jane, who raised, of course, some serious concern around the issue of the PPE procurement in the province. Of course, this has been a major issue here in the Gauteng province. You will recall some of the complaints that emanated during the first phase of infections here in the province, really around the lack of personal protective equipment for many of the staff and nurses in some of the hospitals. And of course, this again seems to be one of the major concerns that nurses are having at this particular point, saying that there's simply not enough PPE available for them to do their jobs. But more worrying for these healthcare professionals, Jane, is the fact that there are still those long-standing issues of overcrowding, the issue of a shortage of staff, which they say continue to cripple the healthcare system in Gauteng. And of course, they're saying that should a second wave of infections hit the province as expected, of course, in the early months of 2021, this could be very crippling, given the fact that they will simply not cope with the number of people that come to these centres, given the serious staff shortages that they face on a daily basis. So there are quite a lot of concerns, Jane, about these issues. Of course, we have tried to raise the issues with the health department. We actually tried to reach out to the health MEC here in Gauteng, but her office has indicated that she will not be available to speak to us today. In fact, nobody from the department will be available due to some of the back-to-back meetings that they'll be holding in the province. But quite a worrying picture that you're hearing from some of the healthcare workers here in the province.
All right, and I know that there are obviously concerns when it comes to the Western Cape. There's been a dramatic spike there. Nobosuthu, is there enough equipment? Are there enough beds? Are they ready?
Well, we will find out about that from Dr. Karim, but what we know from the statement that was released yesterday by the health department, it stated that hospitals in the province are under severe pressure. And just to get a sense of how bad things are, I'm joined by Dr. Karim Sadiq. Dr. Sadiq, can you just tell us about the diverts that the department has to do in hospitals?
Sure. I think we're seeing the snowballing effect of the exponential rise in cases in the province over the last few days. And unfortunately, that's placed our hospitals under significant pressure. As a result of that pressure, we obviously have to now put into place our management actions. One of those being diversions, what we call diversions. At the moment, we've had over the weekend, we've had 11 private hospitals asking for diversions in the province, and we've also had 2 or 3 of our public facilities that have really borne the brunt of the significant increase in pressure.
And we also understand these are not only due to the spike of COVID in the province, there are also other factors or other illnesses. So can you just give us an idea as to what happens?
Absolutely, and unfortunately it's the colliding epidemics, let's call it that, colliding epidemics of COVID as well as trauma. We've seen a significant amount of trauma, unfortunately, in our hospitals over the weekend, particularly in our public hospitals. And we also at the same time understand that during lockdown we've had to de-escalate services, so we have been trying to re-escalate those urgent cases as well. So all 3 of those factors combined have led to this snowballing effect and the pressure that we're seeing on our hospitals. We have in the public sector just over about 5,000 acute care general beds, if we exclude the specialized units. And what we will be doing is, in addition to adding some more field hospital type beds to the platform, we will also be having to de-escalate services in our hospital beds and then repurpose those beds for COVID care, much like the private sector have also had to do.
And I think another question is, will we then see the reopening of field hospital like the Hospital of Hope we've had during the first wave?
We're not reopening the convention center, but we're using the same strategy and reopening what we call intermediate care or field hospital beds, if you like. But this time we're using our existing facilities. We plan to open about 263 of those beds in the next week or 2. And in fact, we're also looking at opening additional acute care beds in hospitals such as Tygerberg Hospital, where we are at the moment. So we want to bring both additional beds into the system, as well as we want to repurpose some of the existing beds into our system. And we hope that that will be enough and sufficient for us to cope with the demand.
And seeing what we're seeing now during the second wave in December and having diversions in hospitals, is the department concerned what might happen in January next year?
We are extremely concerned about it. We know that traditionally a lot of people move between the Western Cape and Eastern Cape over this festive period. And we're already seeing this exponential rise. So come January, we are extremely concerned that the situation might be even more dire when people return from the Eastern Cape again. And with the festive season, unfortunately, there's a lot of movement of people still. People are out, there are people who are gathering, there are social gatherings taking place, which unfortunately leads to large super spreader events. And that is what's just driving the numbers up in the province, and I'm sure that's happening around the country as well.
All right, thank you very much. That was Dr. Sadiq Karim from the Health Department in the Western Cape, painting a picture of how bad the situation is in hospitals in the province. He does say, though, that they're not planning to reopen the convention center, which was turned into the Hospital of Hope during the first wave, but he is saying that they are concerned with the increasing numbers and what we might see come January 2021.
All right, thanks for that, Nobasuthi. We're going to be keeping the focus today on the second wave in the country, the state of readiness as we head into the festive season.